Hi there, welcome to my video lesson on the interior muscles of the arm. So we have the bicep brachii, which is drawn here on my arm on the right side, and then we have its deeper brethren, the coracobrachialis and the brachialis. This video is going to discuss basically the basic function, structure of these, along with some clinical notes, which I think will be useful for those who want to apply this to their exercise regimen or just their general knowledge. So to begin, the bicep brachii is a striated muscle on the front of the arm, which consists of a short head and a long head. So the long head is laterally placed on the outside of the arm, while the short head is medial towards the inside of the chest. The purpose of this muscle is to provide flexion of the elbow, but also supinate the forearm. So it is actually a flexor and supinator simultaneously. The deeper muscles, the coracobrachialis and the brachialis. The coracobrachialis assists with adduction, which is bringing the arm back towards midline and also flexing the elbow, whereas the brachialis strictly is for flexion only. So all three of these muscles work together to do this essentially, although the bicep brachii is the supinator of the three. So when we're talking about clinical implications, if the bicep brachii is torn, for instance, then you're going to have a very hard time performing a supinated flexion movement. Whereas if there is no damage to this muscle, then this will be pain-free. Whereas if you do have damage or if there's something going on here, this motion becomes very difficult with the forearm, with the palm facing upwards. This would be a good time to review the pronation versus supination video, which I did previously. So the brachialis is deeper, but it also assists with this elbow flexion. And like I mentioned, the coracobrachialis, just to review one more time, provides flexion assistance, but really doesn't provide any of this supination movement here, because it just simply doesn't cross the elbow joint. Okay, so practical implications here. Okay, in some of my comments I've seen that I come across as a bicep bigot. I am not. I love the bicep. I love all muscles. I am an equal muscle opportunist, so I'm going to focus on you bicep lovers getting the biggest biceps possible, but also kind of giving you some information so when you go into the gym you can just become huge, large, strong, all the above. So the bicep itself primarily gets strengthened through flexion movement. If you really want to challenge this area, I highly suggest performing pronated curls, because the pronation movement does not involve the bicep brachii. This is very simply demonstrated that if you go and do a pull-up, for instance, it's much easier to do a pull-up with the hands with your palms upwards or supinated than it is pronated. And the reason why is because the structure of the bicep brachii, its primary function, because of its attachment to the radius, allows for this assistance with the back muscles in synergy to help pull you upwards, because it is a strong flexor of the arm. So whenever there is pronation activity, this muscle for all intents and purposes is not being used. So you can see this even with speed tests. If you try to move your arm this way with the palm facing upwards, supinated, you can move the arm much faster because you're actually using the bicep brachii, whereas you kind of got this T-Rex thing going on. Like, it feels much weaker if you actually do it this way. So that's just one of the visual demonstrations, so try taking a weight and curling it with supinated grip versus pronated. It's much harder to do a pronated grip. And lastly, I would just like to say, it would be good to just review one more time. Bicep brachii, superficial, two-headed, medial, and long head, whereas we have the deeper muscle coracobrachialis and the brachialis. So build your biceps, build your back. If you're going to do pull-ups, again, kind of back to the exercise and clinical notes, you can reverse your curl or reverse your grip, so you have a pronated grip versus supinated. That will give you more bicep exclusion, flexor exclusion, so you'll be more likely to do harder pull-ups with the back muscles being primarily involved. And I forgot, before I go, a simple clinical note. As I mentioned previously, If the bicep brachii is damaged, a physician will often test under resistance whether or not you're able to do this movement pain-free. If you're able to accomplish this movement pain-free and they suspect a muscle tear, then if it's pain-free, that rules out the bicep brachii for all intents and purposes, so they'll typically investigate something deeper like the brachialis. Lastly, any external environmental noises you may have heard, including my cat, which I love, who is currently in the basement. He has a meow that sonic reverberates throughout all items in my household. I believe my cat is smart enough to know the harmonic resonance signature and frequency of all my items. He can kind of ambulate or kind of just get the meow up to a certain level where if he stands next to a china dish or a china bowl, it will shatter. If he's next to a piece of wood, it will start to crack. So I love my cat, but his breed is so noisy. So this is just a disclaimer for all of you lovers of animals out there. He's downstairs, but I'm about to let him out. Thank you for watching. If you have any questions about what happened in this video, what's going to happen in the future, I can try to predict in general, but if you want to know anything specific about what's going on in this video or in relation to the bicep, future videos, give me a heads up. I'm very happy to be back making videos. Peace and love. Thank you.